Most people feel a degree of anxiety before their first sports physiotherapy appointment because they do not know what to expect, and uncertainty about any medical encounter creates the kind of friction that delays booking. Let me remove that uncertainty completely by walking you through exactly what happens from arrival to leaving your first appointment. The first thing to understand is that the initial session is primarily an assessment, not a treatment. The first 15 to 20 minutes involve no hands-on intervention at all, and that is completely deliberate. The physiotherapist is building a clinical picture, and the quality of everything that follows depends directly on the completeness of that picture. The session begins with a detailed subjective history. Your physio asks when the problem started, what you were doing at the time, exactly where the pain or limitation is, what it feels like qualitatively, sharp, dull, aching, burning, intermittent, or constant, and what reliably makes it better and what reliably makes it worse. They will ask specifically about your sport, what you play, how often, at what level, whether you have had similar problems before, and critically, whether anything changed in your training load around the time this problem appeared. Load spikes, sudden increases in training volume, intensity, or frequency without adequate recovery are among the most common injury triggers in recreational athletes, and identifying them shapes how the treatment plan addresses not just the injury, but the conditions that produced it. The last question, what do you want to get back to doing, is more clinically important than it sounds, because your specific functional target determines what the rehabilitation program builds toward. A competitive badminton player returning to 3 sessions a week needs a different progression pathway than a casual player wanting to enjoy one social game on weekends, even when both present with identical examination findings. After the history, the physical examination begins. Your physio asks you to walk, bend, squat, perform a single leg squat, and depending on the injury, jump, hop, or perform a sport-specific movement while they observe how your body moves and specifically where it compensates under load. They are looking for the pattern behind the pain, the compensation strategies, the asymmetries, the movement restrictions, not just the painful structure itself, because the painful structure is often the consequence of a problem located somewhere upstream. The hands-on assessment follows. Manual pressure to specific structures, passive range of motion testing, muscle strength assessment, and clinical provocation tests targeted at the region being examined. For a knee complaint, this includes ligament stress tests for the ACL, PCL, and collateral ligaments, meniscus provocation tests, and patellar tracking assessment. For a shoulder complaint, it includes rotator cuff strength screening across all 4 muscles, impingement test, scapular control assessment, and cervical spine screening to rule out referred pain from the neck masquerading as shoulder pathology. For a lower limb overuse complaint in a runner, it includes hip mobility in all planes, ankle dorsiflexion range, and single leg loading control under progressive challenge. After the examination is complete, your physiotherapist explains the full findings, what structure is involved, what stage it is in, what the underlying driver is, a realistic recovery timeline, and what your treatment plan involves session by session from this point forward. This explanation is not an afterthought. Understanding specifically why you are injured and what your body needs changes how you manage it in every aspect of your daily life between clinic appointments. You will leave your first appointment with specific exercises calibrated to exactly what the assessment revealed and a clear timeline for progression. The explanation your physiotherapist gives at the end of that first session is not just background information, it is part of the treatment. Understanding why a specific movement hurts, what the tissue needs to recover, and what you need to avoid versus what you need to load changes how you manage your injury across every hour of the day between clinic sessions. That clarity, knowing specifically what is wrong and exactly what needs to change, tends to be the thing patients mention first when describing the difference between a physiotherapy assessment and a standard doctor's appointment for a sports injury. Starting those exercises correctly from day one sets the pace of your entire recovery. The link in the description covers what sports physiotherapy involves across all phases of treatment and how to find a qualified practitioner near you.